Hi there, and welcome to this episode of Experts at EWU. My name is Emma Olring, and I am the host today, and I am lucky enough to be returning with Dr. David Line. How are you doing?
I'm doing very well, thank you. How are you?
Yeah, I'm great. As we all can be, we're hanging in there. We're happy to have you back to talk about the pandemic once again. And I am repping my Gonzaga shirt for a reason. Go Zags. I know we have some rivalry here.
No rivalry. We're all in this together.
Good. I love that. So you are the director of Eastern Washington University Masters of Public Health. You've been on
Yep.
here about a week ago, and you had some great answers to many questions that a lot of us have had, and we have more to come. So I just wanted to dive right in. These are some questions generated at EWU, and just a lot of things that all of us are wondering. So kind of to start off, how are you feeling and other public health officials with Washington's progress in the staying home? How is that looking? Are you satisfied with that? How are we doing overall?
We're very excited about the progress and the success that we've had thus far with Washington State. We were the epicenter of everything happening, and we really were able to stave off a major disaster. And now we just have a big issue that we need to deal with. But in general, we're doing great. But we need to keep up that effort because we are not out of the woods, and we're only doing well because of our activities.
Yeah, and I actually have a question about that. So let's say, a month from now, our numbers have decreased immensely, hopefully, as they will. How does it look like going back into normal life? With these regulations lifted in the future, are we obviously going to see a trend continue? I mean, there's no way to know that the virus is completely gone. So, how are we supposed to, with these numbers decreasing, how do we continue on that way?
So we're going to be doing things like slow starts, slow openings, getting back together in smaller groups, and then eventually progressing to larger groups. The way I think of this is looking at baseball. Baseball right now has three options. They could cancel the season, they could have baseball with no fans in the stadiums, or they could have regular baseball with fans. And I think what's going to happen is they're going to start off either canceling the season or having baseball with no fans. In the same way, when we go to school, school in the fall could be online, but we may be able to have sports practice. That would be an example of how we could have a slow start.
Okay, because they're starting to do that in China now too. Their numbers are obviously very different, and it's probably helpful as a medical professional to have a place to look towards as an example and see what they're doing. And then another particular area, obviously in the United States, that's hit immensely is New York. And I know it's a huge metropolitan city. I'm assuming that's why it's hit the hardest. But what do you suggest for these huge metropolitan areas? Obviously, Spokane's at way less of a scale, but how are these cities supposed to handle such immense populations dealing with this virus?
Well, the only option we have right now is that social distancing, staying at home. In major cities, that's one of the problems they're having is the congestion just makes it so that it's not possible for people to live in apartments. When you have 100 story of building and you have only 10 elevators, people have to go up and down those elevators 6 or 7 times a day just to get the dogs out, to get groceries or whatever. And when you do that, it's impossible to have this social distancing that we can have in Spokane. So it's those types of issues which are very complex and difficult for people living in major cities. And that's one of the reasons why New York, with its density, is having a worse situation than a place like Seattle.
And one thing I've thought about too, and please correct me if I'm wrong, is the air ventilation in such tight quarters too. In a tiny apartment and you have a next door neighbor, one bedroom apartment next door. How does that deal with, the air that we're all breathing in these tight areas? Is that having to do with part of the issue in New York too?
It is, but not necessarily in that setup. Where we are experiencing or witnessing these issues is when people are trying to go out and walk. What we're finding is that 6 foot distance needs to expand to 12 feet or so. And then if you have someone that's jogging, it needs to actually go up to about 30 feet. And so that makes it more complex. more challenging.
Wow. And is that simply because of the activity and the air that we're breathing? Like a jogger obviously is out of breath, and is that why?
Yep. Yeah. They're breathing harder and therefore they're expelling more.
Yeah. Okay, that makes total sense. Interesting. Um,
Mhm.
and the amazing part of all of this is you're seeing good in humanity, workers in various fields that aren't usually the ones to be thanked as much as they should are getting that, whether it's, a grocery store clerk or teachers, because parents are now becoming the teacher. But we're learning that such populations that are dealing with people face to face in the grocery stores, in the nursing homes, in the clinics, they are the ones that we need to be protecting the most because they're the most vulnerable. What other groups of workers should we be protecting, and how do we do so ourselves?
Yeah, so I want to make sure that we applaud those people. These are people that didn't ask to be put in harm's way. Firefighters, first responders, and I am a EMT. I am a firefighter. And I understand that I volunteered to do that, and I do appreciate the applause, don't get me wrong.
Hmm.
But the grocery store clerk, the cashier, the person in the fast food restaurant, they didn't volunteer to be put in harm's way, and they are
Not at
definitely
all.
being put in harm's way, and we need to make sure we give them a shout out. Um, but back to your question, anybody that is close, works in close proximity to anyone else, and has exposure to the disease is at a higher risk. So the
Hmm.
groups that have the highest risks are actually in the dental field. And so we have the dental assistant who's not getting paid very much that has to be in this position, as well as the dentist. And dentists don't make a ton of money, but they do make a little bit more than dental
Hmm.
assistants. And so that's an example of an industry or profession that is experiencing extreme exposure and concern. In contrast, a logger who works in more isolated areas and doesn't have exposure to the disease, they're at a very low risk.
Got it. I'm curious too. Obviously, we've noticed that these elective surgeries are canceled. You're only going into clinics if it's of utmost need. So, are these dentist offices staying open per usual? I haven't heard much about dentistry in all of this.
And people have emergency surgeries and things like that. And that's where the healthcare industry is being majorly impacted because dentists, as you've just suggested, the routine cleanings are being canceled. And so,
Hmm.
how do they stay open? How do they continue to operate when their bread and butter is being eliminated? And the same thing for hospitals. We're seeing a major impact on rural hospitals that aren't able to stay open because they don't have the elective activities. They're
Yeah.
basically just bracing for this crisis, and how they're going to stay open is not clear yet.
And I have another question on that. If we are going into the grocery stores, obviously certain states have put into place everyone needs to wear a mask. We need to be using, resources at home, even if we don't have a true mask to create a mask. What are your thoughts on that? How do you feel on, obviously resources are low within the hospitals. Do you feel like we're doing a good job of equally distributing amongst, the cities that are hit the hardest?
Yeah, so the distinction between a medical mask and a mask that we would create ourselves is considerably different. And so an
Hmm.
old T-shirt, a bandana could be used as a mask. If I was to go shopping, I certainly could just use that. It'd be very simple for me to make or carry, and then I can wear it. It doesn't need to be something that inhibits the ability for a germ to come into my mouth. The reason I would
Hmm.
wear that mask is because I am considering myself ill, and I want to make it so that other people aren't exposed to my illness.
Got it. Yeah, that does make sense. And obviously, for those at home, that's what we should be doing is creating our own to allow those who need the true mass to have them. Um,
Hmm.
I do have some other, question about early on in the pandemic. We were reading that the pathogenesis of SARS and COVID-2 was poorly understood. And since then, obviously, with the research and information that's been released, we've understood more about the biological mechanisms behind the virus. Um, how do these mechanisms differ from past coronaviruses or other ones that occurred in China for SARS example in 2000, also with MERS in the Middle East? How is this a different version of the virus?
Well, it's a different version just because of its own biology. And so, from our perspective, COVID-19 lives outside of the body a much greater time than the normal flu and the other ones that you've just discussed. One of the
Mm-hmm.
things that's interesting is that COVID-19 has to live by rules, and those rules don't change, but how each disease is impacted does change. So SARS was very, very deadly, and that's one of the reasons why it didn't spread as well as COVID-19.
Mm-hmm.
Um, and what we don't know is things like immunology and how long will someone remain immune to COVID-19. One of the terrifying things is what happens if we could get COVID-19 year after year. And if a vaccination is complicated or challenging to come by, that really is a big question and a big issue. And with the ability of COVID-19 to mutate, we've already seen it mutate a couple of times. That's very, very scary.
Yes. And there's kind of been some thought about, whether the temperature can change all of this. People are saying, oh, in the summertime, it's going to be better because it's hotter. It can kill the virus. I obviously am not a doctor. I don't even know if that's something that's true. But can you discuss that and how, by the fall time, could it be the same? I know you just said it could be a different version of this COVID virus, but what could it look like after warmer temperatures, if that's even possible to change anything?
Yeah, so we don't really know everything. We don't know very much about COVID-19. We do know a lot about coronaviruses in general. And what we've done is we've been able to experiment where COVID-19 exists and is able to sustain itself or live outside of the body. And there are optimal conditions. They actually tend to be cooler and with medium or modest humidity. When we go to the summer, we would therefore expect that COVID-19 isn't able to exist as well outside of the body. However, we tend not to stay outside. And when it's 100 degrees or 110 degrees, we don't want to be outside. So if it feels really humid and sticky at 90, we're probably going to be in an air-conditioned facility. And all of a sudden, we've made it so that COVID-19 can exist again.
Yeah. And it's been difficult in all of this where, kids my age, college students, kids in their 20s feel like, oh, they're immune to all of this because in China, there wasn't as many patients that were dying of COVID-19 that were our age. But now, among these patients that are thought not to be at high risk, there have been poor outcomes often related to what you call cytokine storms. Can you explain what those are and how a healthy immune system can kind of be turned against this respiratory illness and how it really can affect, any healthy person?
That's a great point. We tend to think of this as we call it the boomer doomer because it was causing a lot of people that were older a lot more issues. But with the way the body responds, what can happen is we can basically have what is very similar to an allergic reaction. And that's where the body overreacts to the foreign body that's been introduced. In this case, the foreign body is COVID-19, and our body attacks it, but it overattacks it. That over-attacking can cause us to have an issue. And when it comes to COVID-19, that over-response can also be exacerbated. It can also create more issues in the medical outcome.
Yeah, and obviously, I think now people that felt like they weren't going to be affected by this now hopefully have learned, the severity of all of it, staying at home, taking all those measures, colleges being canceled and going online. That has to help. But I hope this is a wake-up call for people who feel invincible because I think by now we should all understand that we are all part of this and it could happen to really any of us. Um, there have also been some claims that have been made about treatment that I think we need to talk about. We've accepted that some non-pharmaceutical interventions are the best hope to slow down the process 12 to 18 months. But they're also saying that anti-malarial drugs could be effective in the COVID-19 treatment. Can you speak on the validity of these claims? And if they are incorrect, what should we be doing to stop, kind of this false hope? I'd hope you could talk on the claims and how you feel about them.
So from a biological perspective, I'm not really optimistic about the claims. The malaria medication has not really been proven to do very much, and previous studies on other coronaviruses and other viruses just didn't do much. That doesn't mean it's not going to, but we need to temper that expectation from a biological perspective. From a social and a political perspective, an economic and ethical perspective, I think this is an important thing that we need to keep in our repertoire. So we don't want to say that we have to go through phase 1, phase 2, and phase 3 clinical trials, which can be very timely and expensive. Instead, we need to say, hey, maybe this is a situation where it requires us to be a little bit more expedient in getting these trials done and getting the tests and getting this medication, if it works, out to the public. And for those that are in a really dire situation, as President Trump's kind of expressed, for those that are either going to just die or not, maybe we need to experiment, but we should do so in a controlled, in a proper way. And I can't express it in greater terms, but Anthony Fauci is the person that is the most aggressive and knows the most about this. He's the person that did this exact process in 1980s for HIV/AIDS. And so I fully respect what he's saying, and I think that for President Trump to say that we should be using this malaria drug, I think that's great. But then for us to also hear Anthony Fauci say, hey, we need to be careful on this, I think it's good that we hear both sides. It's important that we are understanding that there is optimism, there is opportunities out there, and we can do it safely.
Yeah, and from what I'm understanding, you also can correct me on this, it seems like right now there is more collaboration between doctors worldwide than I've ever seen before. Can you just talk about that a little bit? I mean, you guys are all relying on one another, and you're looking at Anthony Fauci for, you know, kind of the leader of all this and explaining it to the public. But can you talk about the internal reliance you guys are creating?
Yeah, so there's been criticism in the cancer field that people are working in silos and they're competing against each other to come up with the solution. That's a criticism of cancer studies. That's not occurring in this COVID-19 response. People are working together. We're sharing how to do testing. We're sharing how the results are. And I have seen more non peer-reviewed studies that have been done and released prior to getting that peer-reviewed than ever before. And it's really exciting because usually to get a peer-reviewed study, to get your studies out there can take 6 months. People are doing the studies within a week, they're out in the public, and then they're getting peer-reviewed. And that's great.
Wow. Yeah. And I think everyone can kind of tell that there's this sense of, like you've said in the beginning, we're all in this together. And we really are relying on the medical field to kind of lead the way. So that's amazing leadership that we're seeing right now. And I just kind of want to wrap it up. And you can add on to this as your final little piece. But how do we better educate members of the public, specifically in Eastern Washington and Northern Idaho, who are pushing against the stay-at-home orders and physical distancing? That could be in other areas of the U.S. too. But what would you have to say for just kind of a final piece of advice and education?
Yeah, I think that what we need to do is we need to listen to what they're saying. They have some very important points that they're making. And if we don't listen to them, we're missing a great opportunity. And the reason I say that is this is not a situation where there's one crisis. We have an economic crisis and we have a health crisis. And once we accept that we have both of those occurring simultaneously, we need to realize that we can and we need to work together. And so when I see the groups speaking that they're going to meet on Easter and they're going to rebel against these stay-at-home orders, I want to know why and I want to think about it. And I think they're representing the economic interests. This is the concerns that we have about people having to go to work because they're considered essential, and then other people not able to go to work, people that are just living marginally, that have a difficult time. We have to understand that this is not a simple thing for us to solve. And if we're all going to work together, we need to listen to each other and see what resources, what opportunities we all bring to the table. So for those groups, I want to have them join the medical teams and say, let's pool our resources. Let's have the medical people provide the medicine, and let's have the social community come together and get that message out, as well as help us get this done. Because if we don't do it, we're going to be right back where we were.
Yeah. It takes the whole team, and we really appreciate that you are able to be here and kind of advise us with all of that, because it's sometimes easy, you know, to get stuck in your own little bubble of, oh, I'm doing everything right. But obviously, there's those that are not. So I appreciate your time, Dr. David Line, and you know, this has really been an informative episode. We appreciate it. And this is our little ending to experts at EWU. Thank you for having us again. We appreciate your time, and we look forward to talking in the future. Stay safe.
Thank you. You also.